All right, let's do it.
I'll put this thing on you.
Having schizophrenia for me was very scary. I want to make sure that I didn't mess up your mic. It didn't fall, but I just didn't know if I touched any buttons or something.
You're totally good.
I'm fine? Okay, just...
Hear you loud and clear. Cool.
Okay, I'm ready.
Slate. Okay, marker.
At first, when I started hearing things that weren't really happening, started in college, I would hear people admit that stuff that didn't make any sense to me. Why is this happening to me? I couldn't go to college anymore.
When he came home, we were all seated here in the den. All of a sudden, Christopher had said, "Stop saying those things, Mom," and I hadn't said anything.
I wanted to stay away from people. It got to the point where I didn't even really trust anyone or myself.
I spent time on my laptop reading anything that I could read on schizophrenia. It's like the worst diagnosis one can have, as far as mental illnesses. I read so much that, my husband would say, "You didn't sleep at all last night, did you?"
1 in 5 adults has a mental health diagnosis. Oftentimes, families just don't know what to do. They're looking for guidance. They're looking for support. We're at the UC Davis Medical Center campus. We provide psychiatry, that's my role, but also primary care, therapy. We have a very robust research program as well.
I love working in an academic environment because it pushes us to do better. We are always trying to push care forward all the time. We have a very close tie between our clinical work and our research. We want to develop new treatments and train the next leaders in the field.
Psychosis is a really broad term, and it really just refers to a set of symptoms. Things like hallucinations, hearing things that aren't really there. Prior to the 50s, we didn't really have antipsychotic medication. There was this tendency to use institutions, involuntary hospitalizations. There was a concerted effort to deinstitutionalize. And I think outpatient treatment models like ours are part of that solution.
I understand you were referred to our program by your primary care doctor.
Yeah.
Your primary care doctor had talked to you about some of the troubles you were having with your thoughts.
Yeah, my mom was the one who really started noticing it.
When we see someone for the first time, we take a lot of time to really listen to the client and the family's story. We take a diagnosis of psychosis very seriously. And so we like to have different members of the team hear the client's story so that we develop a treatment plan that's best for them.
I'm seeing things like it's kind of like...
I saw that UC Davis had a program, and I think that's when I just felt like a weight had been lifted off my shoulders. And then the chore was convincing Chris that he needed to do this.
Hi, Dr. Waddell.
Hi, Chris. How are you doing today?
Doing great. Same as always, trying to make the best of everything.
What have you been up to?
We actually got new animals.
Oh, yeah?
2 twin sheep.
Oh.
Yeah, now we have more animals. Chickens, ducks. At first, I was skeptical, but Dr. Waddell put me on some medication that actually helped me out more.
How have you been feeling overall?
My hallucinations are usually hallucinations that make me feel good, never negative. They're usually always positive. I started to see differences. It got better and better.
Driving back and forth, going to therapy every week, and going to his doctor visit once a month.
Yeah, they got pretty big for him.
It wasn't until after about a year and a half of doing this where I think the light bulb went off in Chris's mind that this is a good thing, that what we're doing is positive, and that made me feel good.
Our treatment program aims to include family members, and we really look at that term broadly. Whoever is seen as a support person, we absolutely could not do what we do without the family support.
Here I have people that know that I'm hard to deal with sometimes, and they're cheering me up, they accept me. That's a lot.
Oh my goodness.
The treatments we have, that includes medications that can decrease the frequency or sometimes eliminate the symptoms.
Okay.
Similarly to cancer or diabetes, there's medications you get to help treat those illnesses. And with those medications sometimes come side effects.
The positives of taking the medications outweigh the negatives of what the side effects are.
She's right. What's it called?
Tardive dyskinesia.
Movement of the mouth.
What's nice about our interactions with Dr. Waddell is she'll ask me if I've noticed anything, and so I can give her my thoughts on it.
We use a lot of cognitive behavioral therapy, and that really teaches our clients how to cope with what they're dealing with towards health.
How's the backyard?
Actually, it's come a long way.
Yeah?
Yeah, a lot of work.
For Chris, going outside is a really important wellness activity, and it's one that I talk about a lot. Getting outside, being physically active.
It gives him a purpose. Yeah, a purpose and a routine. Eventually, we're working towards him possibly having a job.
For Chris, success changes based on what he's hoping for. There's not one answer, and we're constantly figuring that out.
I'm already at a point now where I know what I have to do, help out my family, do the important things, and the good stuff will come later down the line. I thought when it first happened, it was never gonna get better. I guess this is how it's gonna be. And as I started going through the process, things started looking brighter at the end of the tunnel.
Mom was eager for services.
Everyone deserves their chance at happiness, and we want to help our clients achieve their goals. It might be college or getting married and having children, and those are all outcomes we see in the young people we work with. People can absolutely get better who have psychosis.
Chris got back into college, and he did get his degree in liberal arts. I think the stigma is that people with mental illness, it's shameful, and it's not, it's a disease. I think Chris is normal, but it takes a lot of work, perseverance, time. With all that he goes through, he wakes up every morning and he gives 110%. And he perseveres through everything. And he usually sees the best in everybody. He's kind of like my hero, yeah.